So I have heard quite a few times about people going to see someone who practices functional medicine. So I decided to investigate it. There's pluses and minuses to this practice, and I'll try and go through them in some balance, so I'm not too biased. The movement began in 1989 in Canada, and a diverse group of professionals interested in management of complex chronic disease were talking about how they might use a systems biology approach to treating those diseases. Now, systems biology is a relatively young field, and it's what it says on the name. It's they're trying to say that there are fundamental systems within biology that you can study, and it tells you something about the individual. Sounds a little bit like going back to Hippocrates' time to me, but anyway, it was founded. The Institute for Functional Medicine was founded in 1991 to provide postgraduate medical education courses. And the functional medicine model has been adopted by other organizations, and we are seeing it appearing in the US and also in the UK. So there are functional medicine practitioners in the UK, which is interesting. So what are they? It's essentially a recent innovation in medicine, which is not mainstream medicine yet. It's not approved of yet, and that's on safety grounds. But it's getting quite popular. Like I say, I'm hearing people asking me about it quite regularly. Maybe one of my theories is maybe GPs are becoming less accessible than getting attention from a privately paid practitioner is attractive. They also are very good at giving a patient time, talking through what all of their problems are, rather than just focusing on particular sickness issues, particular symptoms. So you may end up with a happier patient, which is great, because that's what we all want. Proponents of functional medicine argue that the conventional model of care relies too heavily on treating symptoms of complex diseases. So instead of treating the disease itself, what they're trying to say is we're just treating the symptoms of that disease. So with aspergillosis, what are we doing? We're not trying to get at what the causes of why you're getting aspergillosis are. We're just treating the infection and the symptoms associated with infection. I guess that's what they're trying to say. Often ignoring the origin of the dysfunction that leads to these symptoms. Well, I would take issue with that, but anyway. Functional medicine is more concerned with addressing the underlying processes that lead to dysfunctions in order to optimize wellness. Now, I accept that's a really good idea. That's really great, but I wouldn't accept that conventional medicine isn't doing that, or certainly doesn't set out to do that. Perhaps that's the perception at the sort of primary healthcare level, but that's certainly, I've just spent half an hour telling you about us trying to get at the basis of why you're getting ill, and we talk about this often: the genetics, the environment, and so on and so on. So I don't particularly agree with that. Detractors may mention that many of the ways functional medicine practitioners diagnose, analyze, and treat are not supported by the evidence. And I must say, a couple of examples that I've come across in the past, I would say that they've overinterpreted diagnostics to fit a picture that they're trying to fit. So I'm not massively impressed by that practice. Medical doctors would argue that they do look at root causes. Okay, so that's what I've just said. So they think there's a better way, and they're getting quite a few patients. In functional medicine, practitioners must take time to listen to patient stories, investigate the individual and environmental factors that influence long-term health. So they're more likely to give you time to talk you through all your problems and also talk about your environment, which I'm guessing a GP wouldn't have time to do. So you can see the attraction to it, and in an attempt to influence long-term health. And no doubt they have some examples of this working. They might be helping lots of people. Personalized lifestyle interventions are introduced based on information from these investigations and the evolving fields of system biology. Well, they're evolving. They're not something I would base my health on. They're in development. So, and again, genomics is something that conventional doctors are working with too. So I don't know, they're being a bit harsh on conventional medicine, I think. An example of what can go on in the US with a conventional medicine doctor working alongside a functional medicine doctor. So conventional and functional working alongside. They would come up with an agreement such as this. This agreement outlines the collaborative care approach between the medical doctor, the MD, and the functional medicine practitioner, FMP, treating the patient's name, with the goal of providing holistic and integrative treatment plan for the patient's chronic disease. So they're going to look at lots of different angles, and in the hope of treating this patient. Of course, this is America, and in the UK we would have trouble with this because if you want the NHS to pay for it, they would not pay for a lot of this stuff. But that's a practical problem. The medical doctor will perform diagnostic tests, prescribe medication, provide conventional medical treatment, monitor the patient's vital signs and laboratory results, stability, effective medical management, ensure patient safety by overseeing pharmaceutical treatments and any acute medical interventions as needed, provide regular updates to the functional medicine practitioner about the patient's medical progress and any changes in conventional treatment plans. Okay, so keeping the functional medicine person fully informed. The functional medicine person, on the other hand, will develop a personalized functional medicine treatment plan, complements the medical doctor's approach. So focusing on root cause resolution, nutrition, lifestyle, and supplement. Well, there's nothing wrong with that. We often talk about, I mean, this is almost what we're doing. We're telling you improvements you can make on your lifestyle and your nutrition, supplementation where there's some like vitamin D, for example. So that's not a million miles away from what we're doing already. Address environment, diet, lifestyle factors contributing to the patient condition. That's what we've just said. And advise an appropriate functional medicine intervention, such as, now here it starts to go a bit off track, detoxification. Well, there's good evidence there's no such thing. Stress management, fine. We all need to manage our stress better. Good idea. Dietary supplements, again, good idea within reason. Depends if you're going to go take someone off a balanced diet and put them on something that's a minimal diet for whatever reason you've come up with, and then you start to rapidly run into problems with medical practitioners. Provide recommendations on natural therapies, nothing wrong with that may enhance the patient's wellness and reduce chronic disease symptoms. Great. As long as it doesn't interfere with what else is going on, great. If it makes them feel better, go for it. Collaborate with the medical doctor regarding any potential interactions between the two approaches. So at least the medical doctor is aware of any supplements and other bits and pieces that they may be taking, and any interactions that there might be between that and conventional medicine, which is a good thing, which would be great. So they must review and co-sign the treatment plan, conventional medicine treatments, functional medicine protocols, regular joint meetings, shared patient records. Great, sounds wonderful. However, functional medicine is not officially recognised in the UK, and I'm about to suggest probably why that is. And the American Academy of Family Physicians refused to award continuing medical education credit for these courses. So some American physicians are sufficiently persuaded, and they're training up to be functional medicine practitioners. But the American regulatory authorities don't agree that that's worthy of a formal medical qualification, essentially. And I probably agree with that at the moment. Why are they being sought out by patients. Gaining popularity with GPs, actually. There are some GPs wanting to train, and there's some who have trained up as functional medicine in the functional medicine approach. So many primary care staff experience high levels of stress, compounded by the challenges of the pandemic. Some may be looking for an alternative, more satisfying way to practice. You end up with a happy patient. What's wrong with that? That's brilliant. Others may be attracted to a system of medicine that targets support. What's that?
Bank balance.
well, no, couldn't possibly comment. The rising number of patients with chronic diseases that are complex to manage in 10-minute consultations. Yeah, well, difficult to find fault with that. There are plenty of patients willing to try a new approach. Yep, especially chronic patients who are having everything that modern medicine can do and are still feeling rubbish. It's not hard to see that they will try other things, which is fair enough as long as it doesn't do any harm. And functional medicine is being promoted through social media, TV programs, word of mouth, and so on. What that says to me is that there's a whole group of vulnerable people who are snatching at something that's being put in front of them, and it's not everything it claims to be, but maybe in time.
Yes, I would say if in a perfect world we'd all have lots of money and be able to go to private doctors, but doctors that can actually do things rather than just getting desperate with this sort of thing.
And is it worth it? Even if you had all that money, and they would charge hundreds and hundreds of pounds, what are you getting for your money? Well,
with a private doctor, you get lots.
Yes.
Yeah.
So many functional medicine practitioners receive training through well-publicised Institute for Functional Medicine courses within the UK. Most offices offer their services in private clinics because it's not something the NHS offers, so it has to be done privately. Interestingly, some GPs, and I've found some, you can look up the practitioners index in this website and find all the names and addresses of practitioners. It says whether they're a GP or not, and there are a few GPs. So yes, so they can learn how to prescribing lifestyle medicine course is the version delivered by the Royal College of GPs. So that's, GPs are being allowed to take on some of the principles and are being taught into some of the principles, which is probably the best way of doing it, best way of going about it. Provides education about the underlying causes of common symptoms and science-based lifestyle intervention. So taking on elements of this functional medicine idea, which is fair, and I think could well be a sign of a very caring GP to do something like that. However, if they're going to practice, they can't practice this in their GP practice. They have to do it privately, and they can't promote this practice within their NHS practice either. Guidance must be followed when incorporating functional medicine into clinical practice. In 2009, the BMJ reported the suspension of a functional medicine specialist, a GP, who worked in private practice for persistently over-diagnosing thyroid problems and prescribing drugs that were not clinically indicated. This is the sort of thing the word danger comes in. They're not properly qualified, and they're over-diagnosing, and then they're over-prescribing stuff that your normal doctor wouldn't prescribe for reasons that your normal doctor wouldn't prescribe. So I just think at the moment, taking on elements, if you're seeing a GP, it's probably a good idea. If you want to find one, and you can find the list of the Institute for Functional Medicine's website, go through a GP. Is this what I say here? Yes, here we go. So that's what I did. So your GP that you see right now may be a functional medicine practitioner, but they can't say that to you when you're in their clinic and you are in their NHS clinic, because they're not allowed to promote. And there's only a few who are, but they do exist. So you'd have to find them through this index. The most functional medicine practitioners providers I could find were advertised as practitioners. These are not medical doctors, and it's really, there's this gap. There's people who are medically qualified delivering this type of care, and there were far more, probably 95% of these people are not medically qualified. They advertised as practitioners, and I think there's a third category of them who are less qualified again. So great that they're being regulated by their own institution, but I think you're introducing, I mean, many times I've heard people saying I've been to see a doctor and that doctor is a functional medicine practitioner. They're not doctors. It's not clear enough, and it's promoting confusion. They also, if the third group, some of these practitioners actually get PhDs, so they can call themselves doctors just like I can, but they're not medical doctors, and they don't make that clear, I don't think, on these websites. So there's not enough control and not enough regulation around this yet. I think it's a great idea. I think GPs taking on elements of this practice is probably good for the people that want it. You are going to have to pay for it, because until we can prove that there's benefit to the NHS patient, the NHS isn't going to pay for it. But who knows? They may take on aspects of it in the future. And they need to remove this possibility of confusion for me. You've got to know that who you're seeing is medical qualified or not. They cannot make claims that they are qualified practitioners and lead people to believe that they are medically trained in some way. That's profoundly dangerous. There you are. So I don't know whether you're convinced or not. I think maybe this is something that's in development and it's on the way, but it needs a lot of work to me before I would be saying go and see one of these people, unless it's a GP already, I guess.